Hi guys, welcome to Radiology 365, where we try to cover core radiology from cover to cover. Today we're going to be talking about hepatic Doppler. Now, we'll first start off with the basic anatomy. Okay, so it's important to understand that the normal liver gets its blood supply from both the portal vein and the hepatic artery, and then it is drained by the hepatic veins into the IVC and then into the right side of the heart. Now, also the direction of flow of blood from the hepatic artery is towards the liver, that is hepatopetal. And same for the portal vein, which is also towards the heart, also hepatopetal. So both the portal vein and the hepatic arteries have hepatopetal flow. And then the flow from the hepatic veins is towards the heart, so in an antegrade manner. So this annotated diagram is just showing us what I've just described. There's a common hepatic artery and branching off into the left and right hepatic arteries, and in the main portal vein branching off into the right and left portal veins, and we can see the arrows denoting the direction of flow. Now, the normal hepatic arteries waveform is pulsatile and also hepatopetal. So this image is a normal hepatic artery waveform, and it shows a pulsatile waveform above the baseline, indicating hepatopetal flow. The peak height corresponds to the peak systolic velocity, and the trough corresponds to the end diastolic velocity. A typical resistive index is 0.55 to 0.7, quite a low resistive index, which is normal for perfusion of organs. Organs are usually perfused at very low resistive indices. For the portal vein Doppler, we have usually again hepatopetal flow, that is constant forward motion of blood, but then it can be phasic, not necessarily pulsatile, but it undulates mildly because of variations in respiration and sometimes in the cardiac cycle. So you have this phasic undulation of the portal venous waveform, and the velocity ranges between 16 and 40 centimeters per second. So this waveform shows us a typical portal vein waveform which undulates mildly, that's phasic, and constantly above the baseline, which is the normal. If this waveform flattens or goes below the baseline, it could indicate increased portal pressure or even a reversal of flow. Now, the hepatic veins feed into the IVC and the right side of the heart. Now, the spectral waveform is pulsatile, and that's representative of the changes during the cardiac cycle. You know, there is really no valve between the hepatic veins into the IVC and then into the right side of the heart, into the right atrium. Therefore, whatever pulsatility or contraction is going on in the heart, these waves are transmitted through the IVC into the hepatic veins directly. So it makes sense that we'll have some pulsatility in the waveform of the hepatic veins. Also, it's important to know that the majority of blood flowing through the hepatic vein is antegrade. So this is a typical waveform of the hepatic veins. The antegrade flow is seen here below this baseline. It's actually an inverted image. Therefore, this is antegrade and this is retrograde. The hepatic vein waveform has four components. There's the A wave, the S wave, the V wave, and the D wave. The A wave represents atrial contraction, which makes sense. So when the atrium contracts, that pressure is transmitted through the IVC into the hepatic veins, and then there's a little retrograde flow. So there's some blood forced retrograde away from the heart during that atrial contraction. That's what we see here. Remember I mentioned that what's above here is retrograde flow because of the inversion of the scale. So this is a little retrograde flow. And then the S wave represents ventricular systole, during which a large volume of blood returns to the atrium. And then there's the V wave, which is atrial overfilling, followed by tricuspid valve opening. That's the peak of the V wave here. That's where the tricuspid valve opens at the peak here. And then there's early ventricular diastolic filling of the heart at this point. Then the D wave represents continued filling of the right ventricle during ventricular diastole. And during this period, there's a smaller volume of blood returning to the right atrium. And then the cycle begins all over again. So this is the hepatic vein waveform, normal hepatic vein waveform, as we saw in this image. Now that brings us to the end of this short discussion. The next thing we'll talk about are now portal vein pathologies. Again, if you are finding value, give it a like, share to someone you think might need this, and subscribe if you have not subscribed yet. I will see you in the next one.